Auscultate heart sound. Have the patient sit up and lean slightly forward, then have him lie supine, and end the examination with the patient in a left lateral recumbent position. Rationale: different positions help to clarify the type of sounds heard. Sitting position is best to hear high-pitched murmurs. Supine is a common position to hear all sounds. Left lateral recumbent is the best position to hear low-pitched sounds. While auscultating sounds at each anatomic landmark, ask the patient not to speak but to breathe comfortably. Begin the diaphragm of the stethoscope. Alternate with the bell. Inch the stethoscope along. Avoid jumping from one area to another. Do not try to hear all heart sounds at once. Rationale: auscultation requires you to isolate each heart sound at all auscultation sites, especially in patients with soft heart sound. Begin at the apex, move systematically to the aortic area, pulmonic area, Erb's point, tricuspid area and mitral area. S1 is louder at the apex and is simultaneous with the carotid pulse. Rationale: at normal slow rates S1 is high-pitched and dull in quality and sounds like a lub. This sound precedes the systolic phase of heart contraction. Listen to S2 at each site. This sound is louder at the aortic area. Heart sounds vary by pitch, loudness, and duration, depending on the auscultatory site. Rationale: normal sounds S1 and S2 are high-pitched and best heard with the diaphragm. S2 precedes the diastolic phase and sounds like dub. After both sounds are heard clearly as lub-dub. Count each combination of S1 and S2 as one heartbeat. Count the number of beats for 1 minute. Rationale determines apical pulse rate. Assess heart rhythm by noting the time between S1 and S2, systole, and then the time between S2 and the next S1, diastole. Listen to the full cycle of each auscultation area. Note regular intervals between each sequence of beats. There should be a distinct pause between S1 and S2. Rationale: failure of heart to beat at regular intervals is a dysrhythmia, which interferes with the ability of the heart to pump effectively. When the heart rate is irregular, compare apical and radial pulses. Auscultate the apical pulse, then immediately palpate the radial pulse. A colleague can assess the radial pulse while assessing the apical pulse. Rationale: determines if a pulse deficit, radial pulse is slower than apical, exits. Deficit indicates that ineffective contractions of the heart fail to send pulse waves to the periphery.